Welcome to MCC's comprehensive comparison of its Blue Cross Blue Shield PPO medical plans. We're proud to offer 3 different options to meet your different needs. All of MCC's plans are Blue Cross Blue Shield of Michigan Preferred Provider Organization Plans, or PPOs. This presentation provides an overview of the similarities and differences between each plan so that you can make an informed decision when determining which medical plan will work best for you and for your family. With all 3 plans, you select your own provider or specialist, but when you choose one that is in-network, you'll pay less out of your pocket. Let's take a look at those in-network deductibles, coinsurances, and out-of-pocket amounts. With our PPO1 plan, benefits include a $250 individual or $500 family calendar year deductible, a 20% patient coinsurance, and a $1,250 individual or $2,500 family calendar year out-of-pocket. The PPO2 in-network plans includes a $1,500 individual or $3,000 family calendar year deductible, a 30% patient coinsurance, and an individual out-of-pocket amount of $4,000 or $9,000 per family. MCC also offers a third PPO plan called PPO-HD. The HD stands for High Deductible. This plan offers a lower premium cost alternative which meets the requirements set forth in the Affordable Care Act. As a result, the high deductible in-network benefits include a $5,000 individual or $10,000 family calendar year deductible, 30% patient coinsurance, and an individual out-of-pocket amount of $6,350 or $12,700 per family. Now let's take a look at the prescription portion of your benefit. Coverage for all 3 plans is administered by Express Scripts. A 30-day supply of medicine under the PPO1 plan has a co-payment of $7 for generic drugs, $30 for brand name or formulary drugs, and $50 for non-formulary drugs. With PPO2, the copays are $15 for generic, $50 for brand or formulary, and $100 for non-formulary drugs. And with the PPO-HD, all prescriptions are subject to the individual calendar year deductible and coinsurance. With the PPO1 and PPO2 plans, however, if you have a prescription which runs longer than 90 days, the mail order option through Express Scripts offers you the greatest cost savings by providing you with a 3-month supply of medication for the cost of 2. Now let's take a quick look at a few specific medical care cost comparison examples. All 3 in-network plans waive the deductibles and pay preventative services at 100%. This includes your routine physicals, health maintenance exams and screenings like your Pap and pelvic exams, routine mammograms, and PSA screenings. It also includes well child care, immunizations, and pre- and postnatal care. Also paid at 100% after a per-visit copay is applied are your urgent care and ER visits. In-network urgent care visits under all 3 plans have a $50 copay per visit. The PPO1 and PPO2 plans have an emergency room visit copay of $100, and the HD plan has a $200 emergency room copay. However, if the patient is admitted through the emergency room, all 3 plans waive that emergency room copay. Now, when you or one of your dependents gets sick and needs to visit your in-network physician, each plan reimburses differently. With PPO1, the plan waives the deductible and pays 100% after you pay a $25 office visit copay. With PPO2 and the high deductible plan, that same visit is subject to its respective deductible and coinsurance amounts. In-network diagnostic and therapeutic services like your diagnostic lab tests, x-rays, inpatient hospital stays, outpatient surgery, mental health, and substance abuse treatment, these charges are all covered. With PPO1, It reimburses 80% after the deductible is met, and PPO2 and HD plans reimburse at 70% after meeting their respective deductible. Now let's take a quick look at 3 commonly prescribed cholesterol drugs, Crestor, Zestril, and Zocor. All 3 are on Express Scripts' non-formulary list, and all now come in generic forms. Because they're all on the non-formulary list, all 3 have PPO1 copays of $50 and PPO2 copays of $100, while the HD plan applies the cost of each drug to its deductible and coinsurance. The generic versions, however, cost $7 for PPO1 and $15 for PPO2. Again, the high deductible plan covers the prescription, but the charges are subject to the calendar year deductible and coinsurance. Now let's take a look at a few free bonus benefits. These are additional services that are available to you at no extra cost. MCC's Blue Cross Blue Shield plans all cover you while you're traveling abroad. Through the Global Core program, you have access to medical services in over 200 countries and territories. Simply carry your Blue Cross ID card with you. If you become ill and need care, call the Global Core Service Center. In case of an emergency, however, go directly to the nearest hospital, then call the center. The center will help locate a doctor or hospital 24 hours per day, 7 days per week. They can even arrange a doctor's appointment or hospitalization for you. Although any co-payments and out-of-pocket amounts still apply, filing claims through the Global Core program is easy. If the service center arranged your hospitalization, the hospital will submit the claim for you. When you visit a provider who does not participate with the Global Core program, you pay for the care at the time of service, then complete a Global Core claim form and send it, along with the itemized bill, to the address on the form for reimbursement. Another freebie we want to make sure you know about is the Mango Health app. This is a diabetes care value program through Express Scripts. This is a smartphone app which engages participants through gamification and incentives to learn more about diabetes and monitor his or her own care. The Livongo Health Diabetes Care Program is a different diabetic care program available to all participants who are diagnosed with type 1 or type 2 diabetes. Livongo provides a technologically advanced blood glucose meter, unlimited test strips, and lancets, as well as personal coaching 24 hours per day, 7 days per week. Again, this program, including the meter, lancets, and test strips, is free to participants. Thanks for taking the time to review your medical options. For more information on these or on any of our plans, please visit our website. Also, please feel free to reach out to the benefits team via email or by calling us toll-free. We're here and we're always happy to help.